Bismillahirrahmanirrahim. Hadith of the day, Prophet Muhammad sallallahu alaihi wasallam said, "Whoever helps his brother in the time of need, Allah will be there in his time of need." Assalamu alaikum, everyone. I am Dr. Marina Akhtar, PGR FCPS Community Medicine. Today, my topic of presentation is Introduction of Health System Management. I am presenting this topic under the kind supervision of Professor Dr.Saira Afzal. Learning outlines, definition of management, principles of management, functions of management, elements of management, management techniques, causes of decision-making error, recent updates, and then MCQs. Learning outcomes. At the end of presentation, the participant will be able to describe the importance of management, its principles, functions, elements, management techniques, role of managers, causes of wrong management. What is management? Management is getting the right things done in the right way at the right time by the right person with the right amount of resources and the effective use of resources. Health system management is defined as purposeful and efficient use of health system resources and getting members of the health team coordinated to work harmoniously in order to achieve the desired common goals and objective. Management involves coordinating and overseeing the work activities of others so that their activities are completed efficiently and effectively. It is the process of organizing, using, controlling human activities and other resources toward the special end. Management is the key process. The function of management is to enable our patient, doctor, nurse team to do their job as easily, efficiently, economically, effectively, and humanly as possible, that they can develop and maintain a caring environment within hospital. Resources. Resources are men, money, material, machinery, and methods. Principles of management: unity of command, span of control, homogeneous assignment, delegation of authority. Functions of management includes planning, organizing, staffing, leading, controlling, coordinating, and budgeting. This picture showing the functions of management. Planning. Planning involves selecting the mission, goals, objective, and action required. It is defined as setting objective, determining resources, and selecting courses, and requires decision-making, that is, choosing future courses actions from among alternatives. It can be defined as deciding what is to be done, how it is to be done. Planning must aim at the fulfillment of hospitals' role in terms of appropriateness, quality, quantity, and the cost of healthcare provided. Organizing. This includes the identification and classification of required activities. The activities then grouped together, and each group of activities is assigned to a manager through the process of delegation, both horizontally among the different managers on the same level, vertically from superior to subordinate. Staffing. This involves filling and keeping the filled position in organizational structure. Leading or directing. This is influencing the people so that they contribute to organization and group goals in effective manners. Controlling. This is measuring and correcting the activities of subordinate in order to ensure that events conform to the plans. Coordinating. This is to making sure that all components of organization are working together in proper sequence to achieve the objective. Budgeting. A careful estimate of resources, expenses is essential for achieving goals of organization. Element of management: personal management, financial management, material management, and time management. Personal management. The function of caring for staff in organization is known as personal management. In hospital service with very few specialists, the effective management of staff lies on the shoulder of head of department. Step of personal management are human resource planning, recruitment, and selection. Human resource planning. Human resource planning is the process of anticipating an organization's future staffing needs and ensuring that it has right number of skilled employees in right positions at the right time. Here are key steps and aspects of human resources planning. Forecasting demand, forecasting supply, gap analysis, developing strategies, training and development, monitoring and evaluation, legal and regulatory consideration. Recruitment and selection. Recruitment is the process of identifying and attracting potential candidates to apply for job openings within the organization. Key steps in the recruitment process include job analysis, job posting, sourcing candidates, screening application, initial assessment. Selection. Selection is the process of evaluating candidates who have applied for a position and determining the most suitable individual to fill the vacancy. It values a more in-depth analysis of candidates' skills, competencies, culture fit within the organization. Key steps in selection process includes interviewing, assessment test, reference check, background check, final decision, offer and negotiation, and onboarding. Financial management. Financial management refers to the strategic planning, organizing, directing, and controlling of organization financial resources to achieve its objective while ensuring financial stability, sustainability, and optimal use of the funds. The following are the key points: financial planning, budgeting, capital budgeting, financial analysis, financial decisions, and work capital management. Work capital management, and then cash flow management, cost management, financial performance evaluation, treasury management, strategic financial planning, and financial leadership. Budget. A budget is a financial plan that outlines an organization's project, income, expenses, allocations for a specific period, typically on monthly, quarterly, and annually basis. Budgeting is a crucial aspect of financial management as it helps organizations set financial goals, allocate resources effectively, and monitor their financial performance. Budget may be developmental or non-developmental. Developmental includes used for a few process of expenditures, usually for a limited period, usually prepared according to annual developmental programs called annual developmental budget, and non-developmental budget needed for non-developmental activities, that is salary, bills, and traveling. Tools for measuring budget: monthly statement, excess statement, accounting, and auditing. Material management. Material management is the process of planning, organizing, and controlling the acquisition, storage, distribution, and utilization of materials, supplies needed by organization to achieve its objective. Effective material management ensure that the right material are available in the right quantity at the right time and at the right cost. This is crucial for optimizing operations, reducing cost, and ensuring smooth production and service delivery. It involves correct planning, sticking to time needs, correct purchasing procedures, standardization, stock and control tools, and documentation for audit. Time management. Time management is the process of planning, organizing, and controlling how you allocate your time to various tasks, activities, responsibilities. It involves making conscious choices about how you use your time to achieve your goal and priorities efficiently. Hospital administrators used to be able to control and fully consume the time of subordinates for the welfare of patients. It can be done by making correct duty roster for organization and see to that everything is done according to schedule. Classification of managers. Top managers include executive vice president, manager, director, CEO, chief operator officer, and middle manager includes regional manager, project leader, store manager, division manager. First line manager include supervisor, shift manager, department manager, office manager, district manager. 3 approaches to define what managers do. First approach is functional approach. First step of that is planning. Defining goals, establishing strategies to achieve goals, developing plans to integrate and coordinate activities. Number 2 is organizing, arranging and structuring work to accomplish organization goals. Leading, working with and through people to accomplish goals. And 4th is controlling, monitoring, comparing, and correcting work. Second role of manager is management role. Interpersonal role, figurehead, leader. Informational role, monitor, disseminator, spokesperson, and decisional role, entrepreneur, disturbance handler, resource allocator, and negotiation. A third role is skill approach. Technical skills, human skills, and conceptual skills. Technical skills are knowledge and proficiency in specific field required for low-level manager. Human skills, ability to work well with other people. Conceptual skills, the ability to think and conceptualize abstract and complex situations concerning the organization. Management approach. Classical management approach that is further divided into scientific management, focuses on optimizing work process and improving efficiency through scientific analysis of task and workflow developed by Frederick Taylor. This approach emphasizes time and motion studies. Administrative management developed by Henry Fayol. This approach emphasizes principle of management, including planning, organizing, commanding, coordinating, and controlling. Fayol's 14 Principles of Management. Henry Fayol is a French management theorist, introduced 14 Principles of Management in book General and Industrial Management, published in 1916. These principles provide a framework for effective management practice and have been influential in shaping modern management theory. Number 1 is division of work, authority and responsibility, discipline, unity of command, unity of direction, subordination of individual interests to the general interest, remuneration, centralization, scalar chain of command, order, equity, stability of tenure of personal, initiative, esprit de corps. Taylor's scientific management principle. Frederick Winslow Taylor, an American engineer and management theorist, is known for developing the principle of scientific management, which aim to improve efficiency, productivity in organization. Key principle of Taylor's scientific management is scientific approach to work. Taylor advocated for using scientific method to analyze and optimize work process. He believed that by studying and analyzing the work task, manager would identify the most efficient methods and techniques. Scientific selection and training of workers. Taylor emphasized selecting workers based on their suitability for task and providing them with proper training. The right person to the right job reduces inefficiencies and improve performances. And third point is coordination between management and worker. Taylor believed in a collaborative approach where managers and workers work together to implement optimal work method. Workers' insight and feedback were valued in decision-making process. Division of labor and specialization. Taylor proposed breaking down tasks into smaller specialized components to improve efficiency. Each worker would become highly skilled at specific tasks. Management approaches. First was classical and second is behavioral management approach, which further divided into human relation approach, recognize the importance of employee satisfaction, motivation, communication in enhancing productivity. Pioneered by Elton Meo's Hawthorne study, this approach emphasized the social and psychological aspect of work. Behavioral sciences approach incorporates psychology and sociology to understand individual and the group behavior within the organization. It seeks to improve management practices through insight from behavioral sciences. Third is quantitative management approach. Operations search uses mathematical models and analytical methods to solve complex organizational problems related to resource allocation, scheduling, and decision-making. Management information system, MIS, focuses on using technology and data to enhance decision-making, planning, and controlling. Fourth is contemporary approach, focus on the coordination of organization part as decision and action taken in one area of organization will have an effect in the other area of organization, and organization are not self-contained, so must adapt to change in the external environment. System approach. The system approach emphasizes understanding the interdependencies and relationship within an organization and its external environment. Contingency or situational approach. The situational approach acknowledges the complexity and uniqueness of each situation and advocates for tailoring management practices accordingly. Management technique and methods. Methods based on behavioral sciences are organizational design, personal management, communication, information system, management by objective. Management by objective, its key elements are participative decision-making, goal specificity, explicit performance period feedback. Advantages and disadvantages of management by objective. Advantages are result-oriented, motivates employees, facilitate leadership, effective planning and control, increase organization productivity. Disadvantages are time-taking, more paperwork, reward punishment approach, coordination problem, and develop conflicting objective. Other is quantitative method. Cost benefit and which includes cost benefit analysis, cost effective analysis, cost accounting, cost minimization, cost utility analysis, input output analysis, model system analysis, network analysis, planning programs, programming, budgeting system, zero-based budgeting, work sampling, and decision making. Decision making in the management steps in decision making: identifying a problem, then the decision criteria, then allocate weight to the criteria, then develop and analyze alternative solution, then to select an alternative, then implement the selected alternative, and then evaluate the decision's effectiveness. Decision is affected by biases, environment, uncertainty and risk, organization culture, decision-making approach, thinking style of decision maker. These are the common decision-making errors or biases due to overconfidence, immediate gratification, anchoring effects, selective perception, confirmation bias, forming bias, availability bias, representation bias, randomness bias, sunk costs, self-serving, hindsight. Now coming to the recent updates. Here is the article, is management essential to improving the performance and sustainability of healthcare system and organization, a systematic review and roadmap for future studies. Recent studies have highlighted the importance of management in the healthcare sector. Positive correlations have been found between clinical and economic performance, although there are still controversy regarding what kind of management and which manager should lead healthcare organization and health system. This systematic review include 37 studies. This study found that performance of healthcare system and organizations seems to be corrected with management practices, leadership, manager characteristics, and cultural attributes that are associated with managerial values and approaches. There is also evidence that healthcare organizations run by doctors perform better than others. Finally, this study provides a roadmap that indicates how the relationship between management and performance of health system and organization can be further and more effectively investigated. Now, time for MCQs. MCQs number 1 is, a health organization is facing challenges in recruiting and retaining skilled healthcare professionals. What strategy should the organization employ to attract and retain the top talent? MCQs, option A is offer them free training. Option B is offer a competitive salary and benefit packages. Option C is centralized decision-making authority. Option D is use a directive leadership style. And option E is by counseling and health education. Anyone? Right option is option B, offer a competitive salary and benefit packages. MCQs number 2 is, a healthcare organization is planning to open a new clinic in a densely populated area. They need to assess the demand for various healthcare services in the community. What quantitative method would be the most suitable for this analysis? Cost benefit analysis, queuing theory, demand forecasting model, and risk analysis, or budgeting system? As there is demand for various healthcare services, the answer is demand forecasting models. Our department Head is setting a long-term goal for department, defining strategies to achieve those goals and allocating resources accordingly. The head is also considering external factors such as market trends and competition. What function of management is the department head performing? What function? He is planning or organizing, leading, controlling, or coordinating. He is planning. Option A is the right answer. A manager is monitoring the process of project and comparing it against the established performance standards. The manager is identifying any deviations from plan, taking corrective action as needed. Which function of management is being performed in this situation? Option A, planning. Option B, organizing. Option C, leading. Option D, controlling. Option E, coordinating. The answer is organizing. The team leader is motivating system members to achieve their performance targets. The leader is providing guidance, support, encouragement to help individual reach their potential. Which function of management is the team leader demonstrating? Leader. Option A, planning. Option B, organizing. Option C, leading. Option D, controlling. Option E, coordinating.
C.
Leader. Yes, leading. Leader is leading. The manager is assessing responsibilities to team members based on their skills and expertise. The manager is also creating a clear organization structure and defining role and responsibilities within the team. Which function of management is evident in this situation? Option A, planning. Option B, organizing. Option C, leading. Option D, controlling. And option E, coordinating.
B.
Yes, organizing. 7 MCQs is, a startup company has secured funding from investigator to launch its innovative product. The management is projecting the company's financial performance over the next 5 years, estimating the future revenues, expenses, profits. Which financial management activity is this scenario described? Financial planning, risk management, financial control, work capital management, and budgeting. As they are planning about their finance, so option A is the answer, financial planning. MCQs number 8 is, a manufacturing company experience disruptions on its supply chain due to unexpected events such as natural disaster and political instability in supplier countries. The management is developing strategies to mitigate the impact of these distribution. What aspect of material management in this company addressing? Option A, economic order quantity. Option B is risk management. Option C is just in time. Option D is lead time reduction. And option E is financial management. Natural disaster and political instability. The answer is risk management.
Risk management.
Yes. MCQs number 9 is, a healthcare manager is responsible for overseeing the scheduling of surgeries, diagnostic tests, and medical procedure. The manager wants to ensure that resources are allocated efficiently, that patient experience minimal waiting time. What time management principle should guide the manager's approach? Rule of third, the Pareto principle, time blocking, just-in-time scheduling, and rapid process improvement.
D.
Yes, D is the right answer, just-in-time. Just-in-time means on the time of need. MCQs number 10 is, the manager is evaluating proposals from different suppliers to purchase new medical equipment. The manager favors a proposal from a well-known from a well-known supplier, assuming that their reputation ensure quality. However, the manager failed to thoroughly evaluate the proposal and misses out the cost-effective option. What cause of the wrong decision making is evident there? Option A, sunk cost fallacy. Option 2 is status quo bias. Option C is authority bias. Option D is confirmation bias. Option E is overconfidence. Right answer is authority bias. Now, this is the key of MCQs, and these are the references of my presentation, and this is the YouTube link of our channel. Kindly like and subscribe, and thank you.